Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us again. Going to have a conversation this morning with Dr. Scott Patch of InterMed, a medical group in Maine, and he's joining us on the program to talk about his practice using telehealth to manage patient care amid this COVID-19 pandemic. Welcome to Health Professional Radio, Dr. Scott Patch, and thank you so much for taking the time.
Thank you, Neil, for having me on.
Well, a bit of your background. What is your area of specialty, and what is your role there at InterMed?
So I'm a family practice doctor, and I am also the Chief Medical Information Officer at InterMed. So I'm the physician who integrates technology into our clinical care.
What exactly is InterMed involved in? Are you a tech company? Do you support clinicians? What exactly is InterMed?
So InterMed is a private practice, multi-specialty group. We have about 100 doctors in our group, owned by the physicians, and we service roughly 70,000+ patients in the greater Portland, Maine area. And so, as we are saying nowadays, we are a combination of a medical group and a technology group because technology is now a very integral part of our business.
We've been hearing a great deal about telehealth in the past decade, but now amid this COVID-19 pandemic, it seems to be becoming the mainstay of healthcare when it comes to patient contact and information analysis.
Absolutely. And so just someone shared some data with me that for a local health plan, they had roughly 100 telehealth visits for the month of February. And for the month of March here in Maine alone, they had over 1,000. So a tenfold increase in just a month's time on the amount of telehealth that's being done here in Maine, and I'm sure completely across the country. And in reality, that's the way you can see your patients in the most safe way for trying to keep as much normal routine healthcare going as possible in this setting.
Is your practice more focused on the sudden upsurge of telehealth practice and the safety aspects of it now, as opposed to just a couple of years ago, it was all about convenience and more about efficiency?
Absolutely. I mean, I think, before the coronavirus hit, we had not done any formal telehealth, and we were looking at it in a way that was patient convenience, but also helping our workforce because we have a fair number of part-time physicians who can only, for child care reasons or other reasons, only be in the office 3 days a week. And how are they able to see patients outside of the office and still keep their productivity up? But once the coronavirus hit and we were faced with the safety aspect for our patients, plus the governor's executive order on discontinuing sort of routine care, only doing things that are medically necessary, we had to shift gears and focus entirely on how are we going to go ahead and deliver that care as safe as possible to our patients who need to be seen. So we still see patients in the office, but those are the acute issues that you have to see because you can't do it via telehealth. But, our diabetic follow-ups, our mental health follow-ups, even some hypertension follow-ups, things like that, we still need to keep doing that business, but it doesn't make sense to bring those people into a potentially higher risk environment when we can do it via telehealth now.
Years ago, it became quite popular for physicians and researchers to collaborate with each other via teleconference, conference calls. Now that the patient is involved, tenfold, do you think that some physicians are better prepared for what is happening now and what is to come as far as telehealth is concerned? Or do you think that there's much more training and hands-on needed? From just your personal experience, because you say yours has skyrocketed, whereas in the recent past you were doing none.
Yeah, I mean, I think there's two things that were going on. One is part of the reason that we were doing none previously is because there wasn't a great business model and the reimbursement from healthcare plans wasn't quite comparable enough to if you've got full practices, to take people out of the office and put them into a telehealth setting. So, that was sort of an impediment in the past. But also now, with FaceTime and with other sort of video technology, many people of all ages are much more comfortable doing video conversations, video consultations. And so it was less of a large step for physicians to step into that environment. In fact, within the first weeks of us going from having no telehealth to over, several hundred a day, some of my most productive telehealth providers were those who were in the latter stages of their career.
So what platform are you specifically using there at InterMed?
So we're using eClinicalWorks, which is our electronic health record, and they fortunately had the telehealth built into their EMR platform, which made it very easy for us to adopt.
So now eClinicalWorks, is this something that you heard about recently? Were you referred?
So eClinicalWorks is the electronic health record. So it's basically that electronic chart that, if you've gone to see the doctors and they're typing in a computer, at our practice, they would be typing into eClinicalWorks. And we've actually been a customer of eClinicalWorks for 12, 13 years. Okay. And so we've been using their product for 13 years. And several years ago, they came out with a telehealth platform built into it, which again, we had been looking at but hadn't really adopted. But once the coronavirus hit, we quickly looked at their platform, and we certainly looked at other platforms, but with any technology, how well it works is how easy it is to use. And so on our side, this was an incredibly easy process for us to adapt, because many of our workflows worked just the same with eClinicalWorks doing telemedicine as it was seeing patients. Scheduling patients was all the same processes, and it was really literally just clicking on the video link within the chart to open up the visit. And then so it was more on the patient side that we had to do some work to get people up on the platform, which eClinicalWorks was very responsive in helping us do that. For other practices, if you're not using eClinicalWorks, you would have to adopt their EHR, I'm pretty sure, in order to use their platform.
Was it like a seamless, you say you've been with them for 12, 13 years. What types of specific changes have you seen within the platform due to this pandemic?
So one of the early, so when we first adopted, one of the things that we liked about the eClinicalWorks platform was it integrates with the patient's portal, so the patient could log into they could see their health record and then launch the video platform to have the visit. And that was a great conceptual idea for us. What it turned out is it was taking a lot of effort to get patients to set up a portal account and log into a portal account. And so when we talked with ECW or eClinicalWorks, we said, we're having trouble getting our patients into the portal in order to do their visits. And, within a few days to a week, they turned around and created really smooth workflows where they send a text to the patient or they send them an email with a link, and you just click on the link and you're right into the visit. So that, that basically transformed our telehealth business from having my clinical assistants be tech support to going back to being clinical assistants. And again, they were able to do it very quickly, and I attributed that to their responsiveness. But also, we've had 13 years of relationship, so we trust each other. We know what we're talking about, and so they could respond very quickly to our need.
Well, Scott, where can we get some more information online about InterMed and about eClinicalWorks as well?
So you can get more information about InterMed at www.intermed.com, and you can get more information about eClinicalWorks at eClinicalWorks.com.
Appreciate you coming in. I know a short period of time for such a vast topic.
Thanks.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Scott Patch of InterMed. Our copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.